Welcome to the Spectrum Vision Partners Compliance Presentation. It is our policy to maintain the highest degree of integrity in delivering health care to our patients. We will at all times strive to maintain compliance with all laws, rules, regulations, and requirements affecting the practice of medicine and reimbursement. We will bill only for services that are actually rendered, coded accurately, documented correctly, and are medically necessary and reasonable. Our compliance officer is Jane Grogan, and she reports to the Clinical Governance Board. All are encouraged to comply fully with requests made by the compliance officer. Failure to comply will result in disciplinary action. Training and education. All employees will receive training on how to perform their jobs in compliance with the standards of the practice and any applicable regulations. And each employee will understand that compliance is a condition of continued employment. All affected employees are required to attend a 2-hour or other approved program related to fraud and abuse compliance per year. A list of approved compliance educational training programs will be maintained by the compliance officer. Attendance at compliance education training will be documented and maintained by the compliance officer. Coding, billing, and collections. Coding and documentation. All physicians are expected to know, understand, and comply with the essential requirements of all government and private payer programs. Each provider will be responsible for ensuring that the appropriate codes, CPT, ICD-9, ICD-10, modifiers, etc., were used for the services rendered prior to submission of any claim for payment. Claim submission. No provider or other staff member may submit a claim for payment for services or supplies which were not provided by the practice. No provider or other staff member may alter claim forms or medical records for the purpose of obtaining greater reimbursement than the practice is legally entitled to. Do you have questions and concerns? All employees are expected to read the summary and the full compliance plan and understand the principles. Fraud and abuse regulations are complicated and may need further clarification beyond the materials contained in this plan. All employees with questions regarding this plan, any fraud or any abuse law, or any regulation or compliance in general are strongly encouraged to seek out the compliance officer. Reporting violations or suspected violations. Reporting violations of any federal, state, or private legislation, regulations, or requirements is required to notify the compliance officer. You can do that by email or other written correspondence. This will be documented and action will be taken. What if they are not immediately available? Employees can report the violation to the Chief Executive Officer or the Chief Operating Officer. Confidentiality. Do you need to make a report and afraid? It is the practice policy that no retaliatory action will be taken against an employee who makes a report under this compliance plan. Such report was made based upon a good faith belief that a violation has occurred. Whenever possible, the practice will make all reasonable efforts to keep confidential the identity of the reporting employees. Employees who wish to make an anonymous report of violations may do so by calling the compliance hotline at 516-253-5491 or can fax a copy of the incident report to 516-804-5292. How will it be handled? The compliance officer will conduct investigations in a timely manner. The compliance officer may consult legal counsel with respect to any reported violation to ascertain the most appropriate means of investigating and responding to such a report. Remedial action: that the violation ceases immediately and that the violation will be prevented from occurring in the future. All reports of violation, investigative findings, and remedial action taken will be documented. Disciplinary action: what is involved? Any provider or other staff member who's found to have committed a violation or violations will be subject to immediate disciplinary action. The level of such disciplinary action will be determined by the compliance officer only with the inclusion of the Human Resource Director and/or legal counsel based upon a number of factors, including, but not limited to, the following: the nature of the violation or violations, the employee's level of intent in committing such violations, and special circumstances surrounding or contributing to the violations. The types of disciplinary action are admonishment, written reprimand, suspension, or employee termination. In addition, disciplinary actions set forth above, the practice must turn an employee who has committed a violation over to the appropriate authority for criminal prosecution, as appropriate or as required by law. Auditing and monitoring. To ensure ongoing compliance, the compliance officer will conduct regular auditing of practice functions and operations, subject to fraud and abuse laws and regulations, and the payer requirements of Medicare and Medicaid, both traditional and managed care products. Those practice function operations include, but are not limited to, the following: documentation and coding for services rendered, claim development and submission, collection and payment, medical necessity and reasonableness of services performed, and overpayments. In addition to internal audits, the Clinical Governance Board and/or the compliance officer shall have the discretion to arrange for periodic audits by an outside auditor with specific expertise in the above identified areas. Please check your packet. This is an incident reporting form that you can use to be faxed over to the compliance officer. This concludes our presentation of compliance. Before we end, make sure you sign the acknowledgement form. Thank you very much.